Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even few are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.
Welcome to VITALS. I'm Dr. John Langell, President of Northeast Ohio Medical University. We are pleased to bring you VITALS in collaboration with University Hospitals of Cleveland. VITALS is an open forum to hear from today's national leaders who are transforming the healthcare landscape using the VITALS tools: value, innovation, technology, advocacy, leadership, and service. Today, we are honored to welcome Deborah Hayes, a nationally respected healthcare executive and advocate for excellence in patient care, innovation, and leadership. Hayes is president and CEO of the Christ Hospital Health Network. With more than 3 decades of experience in the healthcare industry, she has built a distinguished career centered on advancing safety, quality, affordability, and exceptional patient experiences. Under her leadership, the Christ Hospital Health Network has earned recognition as one of the nation's top health systems. Deborah Hayes exemplifies servant leadership and a lifelong commitment to healthcare transformation, education, and community engagement. Please join me in welcoming Deborah Hayes.
Well, first of all, I want to say thank you, Dr. Langell, for that wonderful introduction, and I'm really happy to be here with everyone today. And if you give me just 1 minute, I will pull up my slide deck for all of you to see as we think about our conversation today. I want to talk a little bit about leadership, both yesterday, today, and tomorrow. And, I've been in leadership for about 40 years now. And I've had the pleasure of working with and working for and working amongst many across both our local organizations and our local communities, as well as across the region with wonderful people like the NEOMED leadership team, as well as from people all across the nation. So I thought what I would do today is maybe a little bit something different than other speakers have done. I really want to focus on something that I think is extremely important in the healthcare industry today, and what is either going to make us dramatically different or not from the standpoint of how successful we are tomorrow. Now, I have a captured audience here for the next 20 or 25 minutes. And I just want to say these are my own views, but hopefully they'll resonate with all of you, because the future is often, and certainly in my career, colored by the past. However, within it, there are people that, were thinking about what the future could look like. Those leaders all had vision. And, I'm quite confident that they weren't sure at the time how they were going to get from one place to the other, but they knew they wanted to go somewhere. They weren't always sure how they were going to do it, so they had to figure out the how. And they also knew that they couldn't achieve the vision without a lot of different people, different kinds of people around them. And they knew that it would take the power and the spirit of dedicated people working with them who understood what that vision was to make sure that it became reality. And those leaders who had vision constantly thought about what could be true. They never took no for an answer, and they always figured out a way. They fought for their causes, and they inspired others to have that same vision with them. And they are people and were people who, in many cases, had all the odds stacked against them, but they never gave up. And in fact, they stood up and stood out with their heads held really high, both about legacy, but also about the future. And they created paths for success. And it's my humble opinion that we need leadership more than anything else in our industry in order for us to be successful in the future and continue to provide for the communities that we all serve. So when the teams at NEOMED asked me to speak, I thought, well, my gosh, what am I going to say to all of you? And how am I going to help inspire those who would be listening? And how might I talk about anything that would be influential for those that are watching and listening? So after I thought about it, I thought, well, first of all, people need to understand who I am. So maybe I could talk a little bit about who I am and where I work. So I work for the Christ Hospital Health Network as the president and CEO. Just a little bit about our organization. We are $3.9 billion in gross revenue. We are located about a mile north of the Ohio River outside of Cincinnati, Ohio. And we serve 19 counties across both Ohio, Indiana, and northern Kentucky. We have about 8,000 team members here, both physicians and staff. And you can see on the slide about $70 million in community benefit, which is really, really important. But we are a fully integrated quaternary delivery system. So we have more than 100 ambulatory outpatient centers, or front doors, as we call them. We have a 2-hospital system, and we provide all services except for pediatrics here in Greater Cincinnati. Most and all, at least inpatient pediatrics, is done at Cincinnati Children's Hospital, and it's been like that for many years. But other than burn care and just a few areas of transplant, we provide just about everything there is to offer, both in the acute setting, in the post-acute setting, and you can see those on the bottom of the slide, and in our support services. Also in our organization, we do have a College of Nursing and Health Sciences here. We have about almost 1,000 students there, mostly focused on registered nurse training, but we also do sonography training, rad tech training, as well as medical assistant programs. And then a little bit unique about what you would call us, which is a community hospital on steroids. We do have a fully functional, it's called the Lindner Center for Research and Education. We do a fair number of clinical trials here. We do not do bench research here, but we do translational clinical trials here across the community, have many first in the world's, first in the United States, mostly in cardiovascular, but also in a variety of cancer areas, as well as in a few other of our selected services. With that, we have a huge legacy here. So you see the gentleman on the left-hand side of your screen. That is James Gamble of Procter & Gamble. We are 137 years old, and we call it being founded in compassion and driven by excellence because it was by the great foresight of Mr. Gamble, who gifted the money to that woman that you see right beneath him on the slide, Isabella Thoburn. And his gift is what started Christ Hospital here in Greater Cincinnati in the 1880s. And so James Gamble, the founder and CEO of Procter & Gamble, one of the largest national and international companies in the nation, is our legacy here. And so we're very proud of what Mr. Gamble helped us to do. And we have stayed true to this community as we have provided services for all those 137 years. And there's a quote that he said all the way back there in 1888 about arranging for the adequate maintenance of the finest scientists, physicians, and researchers across the industry. And we're really proud of that legacy. And it gets back to what I said about leadership and having vision, and certainly he did. This is what our mission and vision statement looks like, probably looks like many healthcare organizations across the nation, improving the health of our community and creating patient value by providing exceptional clinical outcomes and the finest experiences. And we really believe in doing so in the most affordable way so that everybody in the greater Cincinnati and in this region can receive the finest healthcare anywhere in the nation. You see there our vision and our core values about why and what is important to us and how we all, as not only leaders, but as team members, agree that we're going to move forward in providing care to the communities that we serve. Now, you say, well, how do you know whether you're doing a good job? And as I always say about teams, we are not a sports team who has some kind of trophy that you can hold up or big rings with a lot of diamonds on them, but we do have external validation of whether or not we're doing a good job. And I'm very proud to say that over the 38 years that I've been here, the Christ Hospital Health Network certainly has demonstrated that it is being true to its mission, its vision, and to the core values that we all serve. And you can see just a number of them. I actually asked our teams to take all the words off of here and put all of the banners from the different organizations up over the last 2 years. And honestly, we couldn't hardly fit them all on the slide. And I don't do this to be boastful, but I do say to our team members here, this is our validation that we are keeping our promise to the nation and to the people that we serve here in the local community, because these are almost all national recognitions. And it's important for me as a leader, and I hope all of you as leaders in healthcare, to think about it in the same way, because again, we are much more than any baseball or basketball or football team. And it's hard to have our team members understand whether or not we're doing a great job. And this is a way that they can think about that. So what's important about leadership also is a plan. And this is the Christ Hospital Health Network strategic plan. There are 4 color-coded pieces of it, and you can see what those are. Quality, safety, and patient experience are always top of mind. What we're going to talk about today is something really important in the bottom right-hand side of your screen, which is about the team and making sure that you have amazing clinicians as well as support team members working with you in order to apply whatever science it is that you are delivering to the communities that you serve. And then looking for national recognition in some of our service lines is in the bottom left. And certainly at the top of the grid up there on the left-hand side is talking about our operating margin. All of you who are in healthcare, whether you are medical students, practicing physicians, or other clinicians or administrators, understand that operating margins are really important as we think about how do all of us reinvest back in our organizations to ensure that we can continue to provide care to the communities that we serve. So that's a little bit about our organization. Now, I want to talk a little bit about me. Yeah, that's a picture of me on the left-hand side of the screen when I graduated from nursing school in 1989. So I won't allow you to calculate how old you think I might be, but at the time we all wore caps, right? And so I had a little case that I carried around back then. It was a little plastic case. And when the team at NEOMED asked me to talk today, I thought, well, how am I going to get inspiration and what am I going to talk about? So I still keep that little cap case up in my closet. And in that cap case is the cap that you see there. We used to call them souffle cups that we would perch up there on our heads. And I keep a variety of things in there from all those many years ago. So I went and got the cap case out. And so there is that cap. And I often get inspiration from that cap case because there are things in it that remind me of where I was. And so we're going to talk about leadership of the past, leadership of today and tomorrow, and where I think we need to go in the industry. But the first thing I want to talk about today is the hat that you might wear. Now you can see it up there on my head, on the back of my head in that picture. And you can see the actual cap there. So I did a pretty good job of perching that cap up on my head. But as we think about leadership, right, we all have to think about which hat we choose to wear, right? And, the cap that I wore in the back meant something. And it meant that I had achieved some level of excellence because you didn't get that cap in the very beginning. Much like if you're in medical school, you don't get that white coat right away. But it said I had achieved some level of academic excellence and some level of accomplishment. But it also meant that those who came in contact with me now expected that I possessed some level of knowledge and that they might look to me for answers, however scary that might have been back then. And it also meant that I would be able to, or they at least thought I would be able to critically think and analyze and be able to provide evidence-based care in some way that might influence their human experience. Now, all of you in your travels, however long they have been, know that leaders who wear caps like that, whatever cap it might be, are either formal leaders or informal leaders. And it's really important, both of those. And our caps, they come in all different sizes and shapes and different colors, and our caps mean different things to different people. But as I think about leadership in healthcare and I think about where we need to go in the future, what I do know is that that cap that you wear, regardless of what it is, means something really, really important. And as I think about it, what I understand and what I know is that those caps that you wear have a meaning, and we all need to be cognizant of what that meaning is. We also need to understand that whichever cap that we wear comes with privilege. And as leaders, our right to wear those caps means that every day we understand that it is a privilege to wear those caps as leaders. Now, whether you are a formal leader or an informal leader, we also understand that losing the right to wear that cap means something has not worked right. It also means that there is a team around us that is looking at us, right? And we need to be leaders who are nurturing, and we need to be leaders that are inspirational to those that are around us. And we also need to understand that as leaders, whichever kind of cap that we are wearing, that we are setting the tone about what the future may hold for us. And our teams are going to be looking at us as leaders, thinking about how we perceive ourselves, about how we perceive them, and about how we perceive the opportunities in front of us. And so the cap has a meaning regardless of which cap you have on today and which cap you aspire to have on in the future, and what it will mean for healthcare as we go forward, understanding that not only are there tailwinds, meaning things that will help us move forward, but right now in the healthcare industry, there are quite a number of headwinds that we are going to have to face. So I would ask all of you who are listening and watching today to think about which one of these do you want to wear and how do you want to lead when you put those caps on. The next concept that I want to talk about is something that came to me when I was looking in that bag. And I reached down and I pulled out a bunch of bobby pins. Now, on the previous slide, you saw my hair and you saw how that cap was perched on the top of my head. And I thought, you know what? These were really, really important tools, experimental tools, quite honestly, because that cap was not always on the right way and oftentimes it fell off. But they were tools that I used at the time to think about how I could get to an end. Now, as my son said, as he looks at that picture, you didn't always do such a great job. That's true, but those experimental tools that we use, and I collected data every time I put that cap on my head with those little bobby pins. But think about the kind of tools as leaders that we have today. And how do we keep that cap on our head straight and continue to help ourselves and our teams move forward? You think about what we have today, much more sophisticated than those bobby pins. We have big data, and we have large language learning models, and we have agentic AI, and we have precision medicine and genomic health and genomic medicine and everything that goes along with all the scientific advances in healthcare. And I think to myself, as leaders going into the future, how do we use all of that data? And again, up on the slide on the right-hand side, I also have all of the regulatory things that we need to think about as leaders. And so how do we take all of this data, whether we get it from Google or marketplace analysis or regulatory things that come across our desk, how do we take all of that intelligent data and use it to keep our heads on straight and to keep our heads and our paths moving forward? Now, as a leader, what I would submit is it's not what we learn, but it's how we use that information and how we communicate that information so that we can serve our communities well. And we use those tools, like I am showing on the right-hand slide, so that we can inform ourselves, inform our team members, and inform the communities that we serve, along with those that are influencing our industry, so that we, at the end of the day, can have a coherent message to lead people forward. And so what I would submit to everyone is we think about the caps that we wear. We also have to think about how do we ingest this information at levels that we've probably never seen before, and how do we use that information well to create the case for success that we need in order to serve our communities. So what else did I find in my case? Well, I found a pen light. Now, it's pretty primitive, and that's what I used when I was doing my clinical assessments of patients. But today, we have all kinds of tools at our disposal that when I was a practicing clinician, I never had. We have lasers, we have robots, we have an electronic medical record, and gosh only knows what the next innovation might be. And, our healthcare world continues to evolve. What I always think about is how did we get from where I was back using that very simple, unsophisticated pen light to where we are today with all of the advances in the medical sciences, all the way from precision DNA to those robots that you see, and who knows where AI will take us in the future. But what I think of is, what questions did someone ask that sparked a new fire with the tools that we had at hand back then and the tools that we have now? And as leaders of healthcare, both now in whatever cap that you're wearing and long into the future, I would ask you to think about what tools are you going to use to think about how we might do things in a new way? Because as the future unfolds and as we understand the current headwinds in the industry, but we also understand the needs of our communities, the question for all of us will be, how do we do things in a different way so that we can be successful long into the future, despite the many challenges that we understand that are in front of us, both currently and those that are being anticipated? The leaders that we need all of you to be, if you're an emerging leader, or the ones that we need for all of you to use if you are currently in leadership positions, both in an individual practice, in an individual organization, or for those who are leading across the nation, is to be thinking about those questions that you have in a different way. Now, great leaders use the tools like that pen light to shine lights brightly through their organizations. And they always remembered to embrace the potential in front of us and not to get mired in the current struggle of the day. And that is sometimes difficult, but it helps leaders to keep perspective. They often, as we should have when we shone that light into a patient's eyes, ask questions and think about how we could not be deterred by the negative, but how we might be inspired by the path that we hadn't yet gone down, but that was potentially in front of us and just needed to be mapped. And last, what I would say as I think about the tools that we now have at our disposal is that in some cases, it may be much easier to pivot. Now, it depends on how you ingest the data that comes from all those tools. But we do have an opportunity as leaders to make sure and to really think positively about changes that we can make because the tools that we have are so extraordinarily precise that perhaps our trial and error will not be as exhaustive. Now, what I think is most important as we think about leadership in the future is how do we communicate? You see on the left how we communicated when I was in practice as a nurse. A four-colored pen that many people loved, and the different colors in the charts meant different things. Now, we don't do that anymore because almost all, if not all, have electronic medical records. And, you know, those four-colored pens were incredible lifesavers in the world of paper. And, you know, I think about how differently we communicate today in our evolving word. We have things like MyChart messaging, and we have inbox, and we have TikTok, and, you know, text messaging, and X, and whatever else might come in the future. And I always think to myself, what an immense potential that our words have to offer. And are we able to communicate better today because of all those tools, or are we not? You know, I ask myself a question as a leader. How can I and how should we think about communication amongst our teams? You know, I used to write things and write them down on pieces of paper. And what you have to remember, and I hope as leaders that we all think about, every word that we write has meaning. The question is, which meaning do you want to communicate? And how do you want to communicate? How often do you want to communicate it? And what is the message that you are trying to communicate when you do send that message, create that video, send a text, or send a message to a colleague? Do our messages say things like, I care about you as a team member? Do our messages say, you are important? Do our messages say to the community, we understand that you have challenges and we are here to meet them? Do our messages and our words, regardless of which way we communicate them in, send a message to say, I will support you in getting that job done? No matter which way we send them, our words as leaders are powerful, very, very powerful. And I submit to you as we move into the future, the words that we express not only to our communities, but to the people we work for and work with and work around, and to those who do not understand the interwoven complexities of healthcare are going to be incredibly important. So think about, as a leader in the healthcare industry, how do you communicate? Now, the last thing I want to talk about is this. When I look in that case that I found, and that I have up there in my closet, I found my stethoscope. Yes, my original stethoscope. Now, very primitive in these days because now you buy one and you listen and it basically gives you the EKG representation, sometimes on the stethoscope, that we had to think about when I was a practicing clinician. And I think about how rudimentary and how fundamental that was compared to what we see today. But patients today have pacemakers checked via the intranet. They have adjustments made to settings, and nurses and doctors, sometimes from hundreds of miles away, are virtually seeing patients, giving orders, ordering medications, and taking care of all kinds of things that we never could when I practiced as a leader. We have technologies like what we call critical connections, electronic ICUs. We have virtual visits. We have all kinds of different ways to interact with our patients in our communities. But I go back to that stethoscope and I think about what was the most important thing, which is, what did I hear? Now, as a leader, I think, what am I hearing? How am I, or how are you, regardless of what cap you are wearing, listening? And, when we were listening back then, as a clinician, you wanted to hear that consistent lub-dub sound that we all know about, that you hear when you listen to recordings of hearts. It was the protector of the human body, and it determined whether everything was working together. Well, today we live in a world where, the very foundation of how we think about things is often being challenged. And in so many ways, we might even say that the healthcare industry is under attack because it's not the same any longer, and we need to think about things differently. We all read the news, or you see the news through many channels of communication that I just spoke about. And there isn't a day that goes by that the healthcare industry is not in them. I say to myself, and I say to all of you, we can and we have to do much better, and we need to clearly listen to what is going on around us. What I know is that leaders, much like the human heart, are the heartbeats of our organizations, are the heartbeats of our families, are the heartbeats of our communities, and we are the heartbeats in some cases for the patients that we serve wherever we are in the nation. And what I would suggest as a leader, whichever cap and whenever you decide to put particular caps on, listen to those around you, because do you want to listen to the heartbeat that is in normal sinus rhythm, or one that, many of you know this term, ventricular tachycardia, that is chaotic and out of control? But as healthcare leaders, I know that we need to be determined and persistent and creative and disciplined, all the while we are being compassionate, because we are the tireless advocates for many times people that cannot advocate for themselves. I submit that we need to be the leaders whose hearts never stop. We cannot afford to fail in healthcare, and that our hearts need to continue beating that drum of excellence so that that spills over into our communities, so that we can improve their health, improve the quality of outcomes that they see because of our wonderful interventions, and help them to serve and be healthier advocates of their own health so that the communities can thrive. So I've gone over a number of things today. What cap do you want to wear? How are you going to ingest data and think about how you're going to use that data to be a leader in whatever right you choose to be going forward? I've talked about the tools and how are we going to use the amazing tools that we have in order to improve the health of our community. And I've talked about listening and the team, and how are we going to, as leaders of the future, advocate on behalf of our entire industry to ensure that as a team, we are listening carefully, we are responding actively, and we are constantly striving to improve the health of the communities that we serve. And so I hope today has been something that is helpful for all of you. I hope maybe you can take a few nuggets of information away that will help you in your current careers, in your future endeavors. And on behalf of myself, I just want to thank you all for being in the healthcare industry. It is a challenge, but every day I wake up and say, there isn't a better challenge than any one of us could have, because each and every one of you know that every day when you wake up in what you're doing, you're going to make an impact on the life of some member of your team, or quite honestly, on some member of your community in whatever area you live in across this great nation. So thank you very much for allowing me to spend time with you. And I hope this is helpful in so many ways. And with that, I'll turn it over for questions.
Thank you, President Hayes, for your presentation and for agreeing to take some questions from us. My name is Cheryl Powell. I am the executive editor of the Akron Beacon Journal. And before I moved up into an editing role, my journey took me through reporting. I served as a medical writer for 15 years. So this is a interesting topic for me, and I have lots of questions for you. So thank you for agreeing to talk. Now, I love the photo, by the way, with the hair and the hat. I also lived through the big hair days. So, but that notes that you started your leadership journey actually started through nursing, going to nursing school. So how did having that clinical foundation, how has that shaped the way that you lead your organization?
That's a great question, Cheryl. One of the things, I think it's actually been very, very helpful, because quite honestly, in my different roles over the years, I started as a student nurse aide, to be honest with you. And so I literally have kind of done every job that you can possibly think of over the past 38 years, starting, like I said, as a student nurse aide. And it gave me a great perspective on how important the team was, because no matter what area I happened to be involved with, and again, I don't know that I thought about it at the time, but what you start to see is that every member of the team, regardless of their role, is incredibly important. And a lot of times I use the analogy, and again, I love sports. I grew up with two brothers, right? And a father who, if there was a sports something on, we watched it or we were at it. You can be the best that you can be as an individual, but if you do not have a team around you to support what you're doing, it doesn't usually work out very well. And so, because of all the roles that I've played, both as a clinician and then as an administrator, it really has allowed me to understand the importance of that concept.
So when you speak of team, obviously retaining that team is important too, getting the quality team players and keeping them. So how do you approach workforce engagement and retention, particularly in this age where there are shortages in healthcare?
Right. It's a real challenge. And one of the things that I was chatting about today is about listening, right? So as an organization, we call it the team member value proposition. And it's really important, and it's made up of a number of components. One, obviously, we call total rewards, is about your compensation and how we are putting some kind of monetary value on that role. But I would submit to you, it's not always the most important. Obviously, we have to keep up with inflation and things like that. What we hear from our team members is, how are you providing career advancement opportunities? How are you providing voice? So we have a thing called our Team Member Engagement Committee that we work with to listen to our team members. We also do annual and biannual surveys of our team members so that we can hear what they are thinking. So if you think about it, there's always compensation, but there's really about voice, it's about engagement, it's about career development, and it's about being mindful of what's going on amongst the teams. And I always talk about how are we moving and removing the pebbles in their shoes. Because again, healthcare is fast and it's furious and it moves quickly and the science is moving quickly. And so those are the things that we think about in terms of retention. But I'll tell you the other thing that is really important. It's all about communication. And I've learned this over the years. So we have 8,000 team members, right? Well, multiply that in some organizations across our healthcare industry, it might be 138,000 team members. How do you communicate such that all team members understand what the goals are and where you are in achieving those and how they can be part of it? So we do things like executive rounding sessions. We have a CEO email that goes out every Monday that talks about important things. We do open town halls. We do lunch and learns. So there's probably no one right way any longer because there's so many ways to communicate, but it's really about being thoughtful and keeping those fresh so that team members, regardless of where they are, feel like they're a valued member of that particular team.
That could apply across organizations and across many places if
Right.
people want that value.
Right. Mm-hmm.
Now you also you spoke about the fast pace, how the field is evolving, and obviously there's innovation in technology that's constantly changing. Telehealth and AI are two that come to mind. So how do you use that innovation? What role does that play at Christ Hospital to improve patient outcomes and also operation efficiencies?
Right. Well, gosh, and it's changed over time. So if you would have asked me 2 years ago, my answer might be a little bit different. But first of all, I think it comes from having a philosophy about how do you want to ingest the technology. So we talk about it at our organization is not necessarily to be on the bleeding edge all of the time, but to be on the early adopter curve. So we have things today like the use of agentic AI. So we are using things like a bridge that have been rolled out to all of our physicians so that no longer are they typing on a computer when they have patients in their offices. They can use a bridge, which is just one of the names of the technology where they're talking to the patients and it's recording their voice. And then they get a screen that says, here's everything that was talked about, and here are the important pieces. And this is what it should look like. If your note's fine, you can just hit accept. If you want to edit it, you can edit a few things and then hit accept, saving incredible amounts of times for our clinicians who, quite honestly, most of them never took a typing class, right? The other thing that we are doing is using AI to look at reports. So looking at radiology reports where there are many lines of text in those reports, and if you are looking at it for a particular reason and you happen to maybe look over something that says this might be needing follow-up, it finds those in the report and tees those up for us to follow up on. And just in a very short period of time, we have found over 100, and I think it might be up to 150 patients now, where had we not done that, it is likely that the finding on that particular report could have been a cancer that by the time somebody actually noticed it or by the time the patient had symptoms, they would have been in a much more advanced stage. We also look at technologies that make it easier for our teams to do their jobs better. So specifically in the revenue cycle, we are using AI quite a bit to help people understand what needs to be in records before it goes to insurance companies for verification or what they're missing so that we can provide it first so that we don't get denials on the back end. So again, philosophy and excitement about technology, I think, is really important, but not being reckless with the community resources that you have to spend on it.
And looking to enhance and help the providers, not take away
Right.
their roles.
Right. Well, and to be honest, we sometimes have been out in front of things and we thought it has helped, but it hasn't. But I would submit that the light bulb didn't happen the way that it currently is in a day, right? And so there were lots of trials that Thomas Edison used back then. Unfortunately, in the healthcare industry, you can only do that so much before folks become quite fatigued, and for good reason.
I wanted to talk a little bit about the area that you serve in Southern Ohio. It's a mix. I mean, you're in Cincinnati, which is an urban area, but then you also have some rural areas around there too, and some poorer communities, a mix. So what kind of challenges, what's the most pressing need in your region? And can you give some examples of how your health systems try and help address them?
Right. Well, and you state that correctly. And for most health systems today, because the systems are bigger than just an individual entity, everyone thinks that urban and rural are different. I would say there are different aspects, but they're the same in some respects. In the urban areas, we tend to have great needs around mental health, great needs around chemical dependency, great needs in terms of how do we deal with the homeless. The good news in the urban area is you have many more concentrated resources. But in the rural areas, those are much less ubiquitous. Part of the challenge are, in some ways, about can we find providers in those communities. So one of the things that we're doing is partnering with organizations like NEOMED and a variety of other universities who are building medical schools to try and increase the number of providers that we will have in the future. And we're really excited about that. The second thing that we do is to try to populate those areas that need it and build relationships with the rural communities so that we can provide things through electronic means that they cannot provide by themselves, either through virtual visits, through teleradiology, telestroke coverage, things like that, because it's difficult to have providers of every specialty in some of those communities because it would never be economically sustainable for the individual provider or for the health system. The other thing that we've done is offered access to the electronic medical record that we have to those communities and those community partners so that they have the ability to see what we can see and throughout, because we happen to be an Epic provider through Care Everywhere, but giving them the ability to have access to those same technologies that we might have access to.
So I think we have time for one more question.
Okay.
So if you were looking to your crystal ball and look into the future, the vision for the future of your health system, how do you see health system leaders influencing the broader direction of healthcare?
You know, Cheryl, this is why I really wanted to talk about leadership today, because I've lived through now a number of iterations of, healthcare is going to be devastated completely for the future. So I lived through the later era of when DRGs came into play. I lived through the early 90s where, quite honestly, the conversation of today is in some ways much like it was back then. Healthcare is too expensive. We need to do something different. What I really think that we need as a nation is that our generation and the generations coming behind us are using data, using it well, and building relationships with our legislators, both national, regional, state, and local, to listen to what the challenges are and then be willing to pivot and think about how we can provide things in a much more effective way. I hate the word cost effective because for some people, it means how do we provide it by just cutting our way to prosperity? I don't think that's what it means. I think we have to look at ways to be more effective in our care delivery, to be farther upstream. And I think that's where technology and science can help us. We will never have healthier communities by only responding. We need to have healthier communities that we are building from the ground up, and we can use science to make us healthier or help us become healthier. And we have to really figure out how we do that.
Great. Well, thank you so much, President Hayes, for your time today. I'm going to ask Dr. Langell to close out today's program. Thank you.
Thank you, President Hayes, for sharing your inspiring story of leadership and service. Join us next month when we will be joined by Daryl Toll, Acting President and CEO of Summa Health.
Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even fewer are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.